Looks like we're live.
Okay. Welcome, everyone. This is a meeting of the AELR committee to consider a regulation regarding masking, an emergency regulation regarding masking from the Maryland State Department of Education. I would just want to thank all the members who are here, public who will be participating, as well as the press and others who are observing. I would point out that, and also thank the superintendent and the chairman of the board for their presence and in making the presentation with regard to the regulation. I would remind the members and point out to the public that the authority that we have is to say yes or no. We cannot modify the regulation as a body, as a legislature, given the separation of powers. And if the existing regulation expires in the very near future, so that if this regulation before us today is not adopted, is not approved on an emergency basis by this committee, this joint committee, then we would be without any regulation regarding masks in the public schools of the state of Maryland. With that, I would like to ask my co-chair, the Senate Chair, Senator Elfreth, for her remarks.
Thank you very much, Chair Rosenberg, and thank you to the staff for putting this hearing together. Thank you to the members for being here. We are at a quorum. There are 19 members of AELR. We need 10 for a quorum, and we are thankfully above that this morning. So thank you for making the time, especially before session. As Chair Rosenberg mentioned, the regulations, emergency regulations before us are in addition to the regulations that we voted on in September. Today's hearing we will first hear from Chair Crawford, Superintendent Chaudhary. Then we will hear from witnesses. We have 8 witnesses signed up. We'll take a brief recess, and then we will do our voting session and allow members the opportunity to explain their vote if they would like to. With that, I will welcome Chair Crawford and Superintendent Chaudhary to explain the regulation, the debate within the board, anything they would like to share with this committee for our consideration.
Thank you and good morning, Chair Elfreth, Chair Rosenberg, and members of the committee. I'm Clarence Crawford and serve as President of the Maryland State Board of Education. I want to thank you for this opportunity to come and to provide testimony on our emergency regulation that was promulgated by the State Board on December 7th that would extend the protections against COVID-19 and its variants by extending the statewide face covering requirement beyond the February 25th, 2022 deadline. The proposed regulation also implements procedures to end face coverings by providing off-ramps for local school systems. Last spring, the State Board unanimously passed a resolution that called for the return to safe full in-person learning for students and staff with minimal disruptions. That became our North Star. As you recall, in August, the State Board passed a regulation requiring face coverings inside of all public school facilities. This was after we had initially implemented a voluntary measure that was not fully successful. And as you recall, on September 14th, your committee held a public hearing and the emergency regulation was approved, and we thank you. Since that time, the face covering regulation has minimized quarantines and helped to ensure a safe learning environment for our students and staff. Without any action, the existing regulation will expire on February 25th, 2022. The State Board believes that we must prevent that from happening because transmission rates are high in all 24 counties. Throughout the fall, the State Board received reports during our public board meetings, information about reopening logistics and COVID transmissions. And in November, we convened a special meeting to get public comment on the face covering. The meeting featured public commenters, and several panels that included parents, students, key education stakeholders, and national public health experts. In addition, we heard from the Maryland Department of Health and MSDE. So we listened. We got a lot of emails. We read the emails. We tried to approach this in a very thoughtful way. This proposed regulation was overwhelmingly approved by the State Board and incorporates what we learned throughout the fall. This emergency regulation is a preventive measure, and measures like this have the support of parents in Maryland and across the United States. With the new regulation, as we've done in the past, we would monitor this on a monthly basis and assess the need to continue. Our goal, again, is to make sure that we provide a safe learning environment for our students. We have seen the effects of COVID-19 and the extended virtual learning, the learning loss, and we've also seen the impact of virtual learning on students with the first marking period, and you see a decrease in academic achievement and an expansion of the achievement gaps. At this time, I'm happy to answer any questions, but if you wouldn't mind, I'd like to turn it over to our State Superintendent, Chaudhary, to explain the emergency regulation and its off-ramps. Again, thank you very much for this opportunity. We greatly, greatly appreciate it.
Superintendent Chaudhary.
Thank you. Thank you, President Crawford, and good morning, Chair Alfred, Chair Rosenberg, and members of the committee. For the record, I am Mohammed Chaudhary, State Superintendent Schools, and I'm here today to support the emergency regulations that the State Board of Education voted to move forward at their meeting on December 7th. As you know from our testimony in September, our goal is to keep all schools safely open. The State Board's action represents a critical step to ensure that students, educators, and staff can continue to attend school with minimal disruptions throughout the rest of the school year. We continue to work closely with the Maryland Department of Health to update and implement guidance focused on layered prevention strategies to protect students, teachers, staff, visitors, and other members of their households while supporting in-person learning. This includes a strong encouragement that all students and staff eligible to receive the vaccine do so, that we employ robust testing strategies for individuals that are symptomatic or exposed, and that individuals maintain 3 feet of distance whenever possible. It also includes updated quarantine guidance to minimize missed school time while protecting health and safety. Unfortunately, with transmission rates high across the state and Omicron raging across the world, we cannot allow the current emergency regulation to expire on the 25th or February 25th with nothing in its place this school year. As I visited schools across the state this fall, I've worn face coverings with students and staff in classrooms and hallways and school buses. And overall, it has been working. There have been issues, but it has not been in the aggregate what I have witnessed and seen, and I've heard from our state local superintendents. The proposed regulation reflects input from families and educators around the state, experts, and lessons learned from states and districts across the country over the past few months. On November 16, 2021, in a state board meeting, we dedicated a public meeting to basically collect input. We've heard from varied perspectives and opinions on the face covering requirement from students and families and medical experts. The meeting featured several panels that included parents and students, key education stakeholders, and national public health experts on the topic. Additionally, MDH and MSDE provided an update on COVID-19 matters, including school metrics. MDH and the CDC and the FDA and the American Academy of Pediatrics recommend vaccinating children aged 5 years and older, which we continue to push and encourage. This regulation responds to that input by extending the statewide face covering requirement beyond the current February 25th expiration date, but also provides off-ramps, 3 different pathways through which a school or school district can become exempt from the face covering requirement before it expires in 180 days. And what those requirements are 1, at least 80% of the county population is fully vaccinated as reported by MDH. or two, at least 80% of the students of a school it's the staff assigned to that school are fully vaccinated, or three, the county has sustained 14 consecutive days of moderate or low transmission rates of COVID-19 cases as reported in the CDC data. With those parameters, the decision to lift the face covering requirement is shared between local school boards and local superintendents. One, in counties where 80% of the population is fully vaccinated, the local board may lift the face covering requirement in a public meeting through a motion. In schools that where at least 80% of the staff and school staff are fully vaccinated, the local superintendent may, after collecting verification from the school principal and sharing it with MSDE, lift the face covering requirement for the school. And then pathway 3, in counties with 14 consecutive days of moderate or low transmission rates, the local superintendent may lift the face covering requirements, but must reinstate it if the county sustains 14 consecutive days of substantial or higher transmission data. The aggregate research behind face covering as a mitigation strategy is strong. As I've shared in September, a few major studies conducted throughout the US and published by the Journal of Medical Association demonstrated strongly that wearing a face covering substantially limits the spread of respiratory droplets from an infected person to an uninfected person. The face covering regulation helped many more students in Maryland safely stay in schools and keep schools open. Indeed, in states that chose not to require statewide face coverings, disruptions and school closures have been far too common. These are the headlines we have largely avoided throughout the fall in Maryland. Across our 14,000 public schools, serving more than 900,000 students, we have had only one single school closure. And it happened right at the beginning of the requirement, arguably due to transmission happening right before the requirement went into effect. The statewide face covering requirement continues to be critically important as we head into the spring semester, especially as the Omicron variant spreads rapidly and as every county in the state grapples with high transmission rates across the county, according to the CDC. And yet the approval and availability of vaccines for children aged 5 to 12 and the recent news of the soon to be available booster shots for young people aged 12 to 15 has prompted many public health experts to look ahead to a time when COVID is an endemic instead of a pandemic. We must plan ahead for the conditions in which a statewide face covering requirement is no longer appropriate. That is exactly what this regulation does. It also draws on early experience in states such as Massachusetts, where schools with 80% vaccination rates are beginning to be exempt from the statewide face covering requirement without substantial increases in case rates. Knowing what we do about the toll of the last 2 years have taken on our students and their learning, we are doing everything we can to ensure that we do not experience persistent classroom shutdowns again throughout this school year. This commitment to in-person learning made the state board and MSD is one that I strongly adhere to. And this fall's original face covering requirement has been an important piece of a layered protection strategy for advancing health and safety of all members of the educational community. February 25th is not the time to allow this protection to disappear. I applaud the state board for having the foresight necessary to advance this updated emergency regulations, which both extend the face covering requirement and implement wise research-based off-ramps from that requirement. I appreciate the opportunity to speak to you today and request that you move forward with the approval of the emergency regulations. Thank you.
I'll recognize the House members and I see Delegate Shoemaker has a question.
Thank you. Thank you, Mr. Chairman. If I could have a little latitude, I've got a couple questions and I'll try to muddle through them as quickly as I can. I appreciate it. Gentlemen, just to summarize this proposed regulation that's before us today extends the end date of the regulation that was approved in September beyond February 25th. Is that fair?
Yes, sir.
All right. Is there language in the proposed regulation that's before us today that could possibly extend the masking requirement into 2023?
No, sir. It's 180 days. It would, one of the recommendations that our that we received during our November meeting from our health experts, and we had experts on both sides of the issue, seemed to imply that the wise thing to do would be to continue the face coverings through the end of the school year and then assess where we are in terms of infection rates, vaccination rates, and the virus itself.
Okay, I appreciate that. So, I mean, I guess based on that information, this proposed regulation would end 6 months from now, pretty much, correct?
Yes, sir.
All right. So, I don't want to beat a dead horse, but I guess I still have the same fundamental concern that I expressed to you all back in September with regard to the regulation that was before us then, about this notion that this proposed regulation usurps local control. And, you may recall, you may not, I won't hold you to it, but, I cited 4101 of the education article that speaks to the notion of local control. And, it says that educational matters that affect the county shall be under the control of the county board of education in each county. So, with that information, again, I'm going to ask, just for the record, if you could tell me how you square this proposed regulation with Education Article Section 4101 dealing with local control.
Yes, sir. And as we said back in September, in general, we support local control. We don't have an issue with it. I think as we talked about it before, there's also an accountability component to it, that you have to exercise control both at the state level and at the local level in an accountable way. So we only entered this issue when we had first attempted, as you would call, a voluntary measure, and that was not fully implemented throughout Maryland. And in one particular jurisdiction, my understanding is that the local board even ignored recommendations from the health department that having the face covering would be a wise measure. So I think from my standpoint is we respect and have no problem whatsoever with local control, but we also have a responsibility to be the final word for education within the state. So perhaps another way to consider this is that we're part of the accountability mechanism as well. We're very careful about stepping into the areas of local control. But in this particular situation, we've been very clear, and only after we made an attempt to achieve the goal did we go in that direction.
Okay. Now, you all had, it was testified to that you garnered a lot of feedback in connection with this proposed regulation in November, I think it was, correct?
That's correct, sir. Yes, sir.
All right. And I don't know if you all took into account the CDC guidance regarding masking that came out on November 5th, along the lines that localities should monitor community transmission and vaccination coverage and screening and all that sort of thing to guide decisions on prevention strategies at the school level, and I guess probably across the board. So, again, doesn't that support the notion that these decisions regarding masking should be made at the local level instead of a one-size-fits-all approach?
Well, again, I think our position is pretty clear. We support local control. We also expect that with local control, whether at the state or at the local level, there's an accountability and a responsibility component to it. As we discussed before, leadership is hard. It's just downright hard, especially in a situation like we have today with so many issues and so many concerns. I'll ask the superintendent to speak to the CDC guidance. I'll just turn it over to the superintendent. Superintendent, if you would just share your thoughts.
The CDC still holds that schools should still be requiring face coverings for the vaccinated, unvaccinated. So that still holds while still monitoring conditions, but there was no off-ramp created by the CDC. This off-ramp rule that we are introducing is more of a new phenomenon that people are introducing. Fortunately, there are states that we can lean on that are comparable to ours to see what their lessons have been. For example, the transmission for 14 days straight and lifting it. That's something Nevada is doing, Massachusetts at the school level. So that's what we built it off of. So that's what I would share.
Well, thank you for that. Since there was a reference made to the off-ramp, Mr. Chairman, I just have a couple questions.
No, we've let you go much further than is.
All right.
Let's move on.
Okay.
All right.
Senator.
Thank you. Senator Eckert.
Thank you very much, and I appreciate everybody's time and energy today, but I do have a couple of questions. Mr. Superintendent, could you just review the off-ramp options for me? I just want to make sure they are in addition to what the emergency regulation we passed before. Is that correct?
Yes, the initial regulation was to require face coverings universally, and then this regulation is to create an off-ramp for basically taking off the face covering requirement. It also allows the face covering requirement to extend to this school year, throughout this school year. And the three off-ramps are, the three pathways for it is one, if a single school has 80% of its staff and students vaccinated, then that principal can attest to that and basically go to their local superintendent and say, hey, we want to lift the face covering requirement at our individual school site. They will attest to that, and then the superintendent would submit that to the State Department of Education, and that school can come off the face covering requirement. So that's pathway one at the school level, at the individual school level. And that's something that's built off of lessons learned that we're seeing in a state like Massachusetts. The second one is if the entire county is 80% fully vaccinated for all those who are eligible, then the board, the local county board of education, can do a vote, a public vote, and with one motion, if it passes, they can lift the face covering requirement for all their schools. So that's the second pathway. And then the third pathway is deals with transmission rates. So the transmission rate, if it's low or moderate, right, the CDC has 4 levels. If it's low or moderate in a sustained manner for 14 days, then the superintendent can lift the face covering requirement for all of their schools. Now, if it goes back up to the high levels of the transmission for 14 days straight, because we want to avoid a up-down phenomenon every day, that's a lesson Nevada learned. They initially had done this and it just became very abrupt. So they created this sustained for 14 days because the virus takes 2 weeks to incubate. So for the third pathway, if for 14 days straight, they are at the 2 lowest levels of transmission, the superintendent can lift the face covering requirement, the local superintendent for all of their schools. But if it goes back up for 14 days straight, they have to reinstate it through the rest of the school year. So those are the 3 pathways.
Thank you very much. And as I understand, that's proven to be effective in other areas. Is that correct?
Yes, I do not take this lightly. I'm a big research nerd and I will constantly read everything. And so I've been paying attention to these schools in Massachusetts. They've had multiple schools that have been lifted. They have lifted the masking requirement. People can still mask if they want, and they are doing fine. Of course, Omicron has introduced a different calculus in
Right,
it,
it's,
but the state has not taken away that authority from them. Even with that, there are school systems that are, that those individual school sites are still continuing that. So yes, and then of course, the Nevada lesson on the transmission rates, I've seen success with that across the county. But of course, now everyone's at a high mark. So it's
thank
built.
you. I appreciate that. And my understanding was prior to the regulation, many of our school systems had instituted those kind of off ramps before. And I think that was one of the discussions we had here in Dorchester County, that there were provisions for some of those indicators. And I guess that was part of my concern back then, that if local jurisdictions had researched this and used those, the local jurisdictions could institute those. So isn't that correct?
Some did. I know St. Mary's was looking at that, but not even half did that, right?
Right, but some did.
Yes, some did, and some put the face covering requirement on, and of course, some chose not to put it on. But you are correct; they are. I think we should not have 24 definitions of off ramps in our state. So that's where I would say we should have a standard definition that we can all come around. But you are right.
Yeah, right. Yeah, well, I appreciate that. Thank you very much. Thank you, Madam Chair.
Thank you, Senator Eckert.
Delegate McComas. You're muted. Delegate, you're muted.
Thank you, Mr. Chair. Just briefly, I mean, I have read pro, con, up, down, and I guess the bottom line is I've come away with realizing that if masks are not properly fitted, or if they're just a cloth mask, they really are, as Dr. Nguyen said, just a decoration. My concern is that we're kind of putting all our eggs in one basket, the masking mandate, and I'm just not sure that's the way to go. I think it's really should be a decision made at the local level. So I'm somewhat concerned that if we make all these different off ramps, in a way, I think it's an equitable issue. And I just addressed this to both the superintendent as well as the chairman of the state school board, that some counties that have a high ethnic or racial minority, and I'll use Baltimore City, they're probably not getting vaccinated at a higher rate as a more homogeneous county. And so isn't this kind of a discriminatory factor, because that community doesn't necessarily, because of the history, doesn't trust the medical establishment, doesn't trust vaccines, because of the Tuskegee Airmen and many of those experiments, as well as the lax situation that Hopkins had. So I just kind of throw that out there, that it seems to me it's better to get the community buy-in and to keep it local, as opposed to one solution doesn't fit all, because Maryland is America in miniature. So I know it's kind of a lot, but just if you please comment on that.
Chair Crawford, would you like to?
Okay, sorry. I'll just speak briefly and then defer to the superintendent. We looked at this issue of off-ramps, and we looked and we listened to what our health experts and others said at our November meeting, and the emails and things that we've got. And that's why we have an off-ramp, a set of off-ramps that are tied to vaccination rates. But they also suggested, for some of the same reasons that you did, Delegate McCombs, that for some communities, they may not achieve an 80% vaccination rate. And that is why we're looking at transmission. So for those communities that may not achieve a high vaccination rate, we didn't want to disadvantage them. And so that is why we have the transmission rates. And again, it's all around keeping the children in school in a safe way so they can learn, because The other alternatives that we've seen, virtual and the other things, while they're well-intentioned, they aren't nearly as effective as in person. Superintendent, please.
At the end of the day, my North Star is keeping schools open and not shutting them down. I've been very aggressive in that, and I will continue to be even through Omicron. And we have avoided the headlines of my old stomping grounds in Texas, Tennessee, Georgia, Kentucky. Those are the top 4 states that have had the biggest set of closures all throughout the fall. Single school sites, entire districts closing for weeks on end. And those are states that either said, you know what, local control on the face covering requirement, or we're going to usurp your ability to even put the face covering requirement. That's what Texas did and Tennessee, and they have not avoided those headlines. So at the end of the day, masking played a role in keeping schools open. And I will continue to have that as a North Star. In terms of vaccination rates, it is much more than just a mistrust. There are structural things across our communities. If you look at the lowest vaccination rates right now across our state, it is not Baltimore City. It is other counties that look very different from Baltimore City. Garrett, Talbot, Somerset look very, very different. It's a combination of structural things, access, misinformation. We live in a world of misinformation right now, which is very problematic, and we will continue to get there. But in the meantime, that's why we created a third pathway. You could do it through transmission rates, although vaccination rates are connected to transmission rates. But I will say, I will come back to respectfully, my job is to keep schools open in person. We should not be going back to what we have done before, and we have avoided those headlines. Only one school has closed, and that was right before the requirement went live. And now we are creating off-ramps that encourage responsible behavior. And so, and it takes us through the school year. I don't plan to come back to you with another emergency regulations on this topic. I think at the end of the day, people need to think about where we go from there, but it does let us go through this school year as we continue to get vaccination rates up. So I would stop there, but thank you so much.
Okay, Senator Hershey.
Thank you, Madam Chair. Superintendent Chaudhary, can we just discuss these off-ramps again, please? The first one you mentioned was 80% of the county population is fully vaccinated.
Yes.
Can you define fully vaccinated?
Basically having both shots in the arms. So it's the count that the CDC and MDH uses to essentially basically say they have both the entire series. Now, if the booster is included in that, which we have not required that both nationally, some states have chosen to say the booster now counts part of the full series. We did not do that here in our state, but basically it's the 2 shots. Obviously, if you take the single shot approach, then that can count as well for one of the vaccines that's in the market right now. So that's what it means by fully vaccinated.
Okay, so it's not including the booster. And is there any type of change that it could occur through the CDC or some other
if the definition
restriction on Maryland?
If the definition changes, if the booster becomes now part of the required and the standard definition, then yeah, it evolves to what the current definition is. So,
and who CDC sets that current definition?
CDC and our FDA sets that, but a state can take the lead and choose to do that. California and a few other states have said, hey, let's make the booster a mandate or a requirement as part of the definition of fully vaccinated. So they could do that if they wanted to, but some are just waiting for the federal level to do it. But there's nothing stopping us from wanting to do it if we do. But that's
Maryland hasn't yet.
Maryland hasn't, and it's not something I can do. I do not have those regulation series under MSDE and the State Board of Education.
Okay. Regarding the first off-ramp, 80% of the county population is fully vaccinated. Do you know currently if there are any counties that meet or exceed that?
Yeah, Howard, Montgomery, they're there. They're very close, but remember, as we opened up vaccinations to our younger students, and now probably in the spring, it will open up to another set of students. But they are pretty much very close. If not, they were there, but then of course, the younger students opened up. So they gotta reach that as well. So we do have some counties that are very close to reaching that if they choose to do so.
Okay, but that goalpost can keep moving if they open up the vaccination to other
If eligibility increases to include a different age group, correct?
Okay, the next one, 80% of students and staff fully vaccinated at a single school. Is that accurate?
That is correct.
And do we know, I mean, that's obviously students, educators, staff, everybody that works or attends a individual school.
At that individual school site, yes.
Okay, and again, do you know, are there any schools that meet this 80% requirement?
We unfortunately at the state level have not been tracking that, and I have not seen a school system that has some kind of dashboard that has revealed. I believe that they will not. I believe they will start tracking that if we pass this regulation. But in terms of where school systems have been tracking, it's just staff, right? Like what percentage of our staff are vaccinated, what percentage of students are vaccinated. Some are using a county measure for that versus doing a more accurate count. But I think this will now lead to more accurate data dashboards around that because there's an off-ramp attached to it. And you can bet teachers and staff and parents at a single school are going to want to track that if that's where they want to go.
Right. And again, in order to remove this face covering mandate, with respect to that off-ramp, a school can act on its own.
Yes, they would just have
Principal can do
to.
it.
That is correct. I would have to create, if this passes, I would create an attestation form. And so the principal will attest, and then the superintendent will attest as well. And so the principal and the superintendent will essentially submit that attestation form to confirm that that school has reached that marker. And I'm using, I built that off of how the lessons Massachusetts learned when they took this approach. So.
Okay, and that does not have to go to the local board of education.
No, that does not have to go to the, like, that is like hyper local control option to come off of the mask if I want to put it that way. Yeah.
Okay, and then with the last off ramp, it has to have the lower moderate rating for 14 days.
Correct.
Do you know, since we've enacted this current regulation, have we been at lower moderate for 14 consecutive days?
It appears the superintendent might be frozen. Chair Crawford, do you have an answer to that question, or could we get back to the senator? Oh,
I think we can get, okay.
Right.
Mr. Superintendent, you were frozen for a moment.
Okay, you guys all froze and I could only move, so I was having one of these weird matrix moments, but yes, I'm back. Sorry.
Welcome back.
Okay.
My question was, Superintendent Chaudhary, do you know that since we've enacted this current face masking regulation, has the system been at a low or moderate, the state, I guess, has been at low or moderate transmission data since this has been enacted for 14 strict consecutive days?
Early on in the fall, we had some that hit that marker, and it was our more highly vaccinated regions. And then we put this in, as later on in the fall, and most had began to shift to the moderate, the higher levels. But we have had some early on in the summer and fall that hit that marker. They were there for 14 days straight. So,
right. And this is county based, not individual school based.
No, it's county. It's a standard definition that's tracked nationally and by MDH
for each county. Okay, thank you very much. Yep. Thank you, Madam Chair. Thank you, Superintendent Chaudhary.
Thank you.
Very thorough set of questions. Mr. Chair.
Thank you. Thank you all. Delegate Jacobs.
Thank you, Mr. Chairman. I was wondering if my senator was going to give me a chance to speak or not.
You two have to settle that yourselves after.
We're going to have a meeting on the side, I guess. But
yes.
But we're very involved in this at our level, and so it's good that we ask a lot of questions, but I have a couple questions for the superintendent or Dr. Crawford pertaining to the off-ramp, number 2 and number 3. And number 2, I want to start with first the 80% school students and staff and teachers, whatnot. In the fall, in November, we talked about the fact that the teachers were not mandated to get vaccines. And so now we're looking at this 80% threshold as on the off ramp. Are teachers at this point mandated to get vaccinated?
Some jurisdictions have decided to do either, they've taken a different approach to the mandate, which is essentially show me you're vaccinated or submit to weekly testing. So they've done that approach. No one has just said straight up in our state that you got to be vaccinated. Others have, right, in many other states, but no one has done that. But they have taken the other approach, and that is more common of show me weekly you're vaccinated or submit to weekly testing. So yes.
So we still don't have a mandate on the teachers to be vaccinated, but
Correct. And sir, I would just add that from my perspective, the board has not discussed this issue, but I would argue that that's a health issue. The health department has historically been the one to determine vaccinations on a whole host of things. So I think that's an area where, as it stands right now, we would defer to the health department to make that call.
well, this is part of the off ramp, so it's a legitimate question. I was just wondering if you had a percentage, any idea of a percentage of teachers that have been vaccinated at this point?
We do. We present that data every month at the board meeting, and they tend to track with where their county is, or mainly they're above average what their county is. And so many counties are in the 80s, the 90s, some in the 60s, but many of our teachers are highly vaccinated and continue to be, and that number grows each month when I present that data. And we will continue to do that every month.
Thank you. And one final question on the 14-day transmission rate reduction. It says that the superintendent can, I guess, do a test that there has been at least 14 days of reduction, and they submit that to the Department of Education or to the superintendent. Who do they submit that to?
They would just let the State Department of Ed know. But the way I want to design it, if pending your approval, is that once they have their 14 days straight, because people will begin monitoring these metrics even more closely if this off-ramp regulation passes. So once they once this passes, or if it passes, right, then they can just monitor like, okay, once that day they hit moderate, or that they hit the bottom 2 levels, the count starts. And so they can just track it. And fortunately for them, the CDC and the MDH does track that as well. And so they can look at that, and then they would just move it. And, we reasonably let your parents know, so you can give them, if it happens on a Friday, give messaging and do all of that. That's why we also did 14 days of, if it goes back up, it has to be 14 days straight. So people are not doing this up down experience that people have to deal with. So yes.
So once the superintendent determines that it has in fact gone 14 days or more, where the transmission rate has dropped significantly, do they need your approval, or can they just arbitrarily do it?
I want them to be able to just move, to be able to, yeah.
So the only thing in effect would be the notification to you, not for approval. Is that what you're saying?
Yeah, but I wouldn't, if they didn't notify me and they notified their parents first, I would be okay with that. Because at the end of the day, I would know that when they lifted it, because there will be public transparency around it, they would have to do it on this data, right? And so I would be fine with that. So,
thank you very much.
You're welcome.
Delegate Learman.
Thank you, Mr. Chair. So I appreciate you being here today, Superintendent. I am speaking as a legislator, and I think maybe the only one so far who's spoken who has kids in, or at least elementary school kids in our public school system. So I guess I'll just say, question for you. You did not know that Omicron, of course, it had not begun to rage when these regulations were initially adopted. Is that correct?
Right when we submitted to them, there was the Omicron conversation, and there was always a knowledge of the winter possibly spiking even with Delta before the word Omicron entered. But no, I did not know that Omicron was going to play out like the way it has. Yeah,
certainly. So I guess, for me, what it boils down to right now, and my colleague, Delegate Simple Hughes may be thinking this too, is, this regulation, if this regulation is not approved, the mask mandate disappears. And it, in my mind, is troubling that while Omicron is raging, we are voting for off-ramps. It's not great timing, because right now the only thing that's possibly, not the only, but one of the most important things that is keeping our educators and our kids safe in schools are masks. So to me, it's imperative that we continue that mask mandate. But of course, providing for these off-ramps in the middle of Omicron raging, when there's so much concern about going back to school, is not perfectly timed. Would you agree with that statement?
I would let me answer that. I would respectfully disagree.
Okay.
Because with Omicron, the thing that I would argue is that the proposed regulation would say that because of infection rates and the like, we would not be lowering, school systems would not be in a position to remove masks. What we've tried to do is to look as far into the future as we can for the next 6 months and say, what is the reasonable, thoughtful thing to do? So the regulation that we proposed would require masking during a high intense period like what we're seeing right now. The regulation also has the flexibility that, let's assume that once we clear the winter and maybe there's not another variant that flares up, that if infection rates come down, vaccination rates go up, more people get vaccinated. The regulation is designed to provide also an incentive for counties and for local communities to of a direction forward. So we weighed that. We didn't know there was going to be an Omicron, but our experts in November said that this may go on for a period of time and that there may be variants that come and go. So we tried to come up with the most reasonable, logical approach. We then also, as the superintendent said, we did not just pull these ideas out of the air, but we looked at what other jurisdictions were doing and trying to understand what works. And then to bring back to Maryland the best information we could possibly have with our most logical and approach that we have. And as you would agree, in an environment like this, there's no perfect solution. There's no way to anticipate what will happen tomorrow. And what we are trying to do is to come forward with a most reasonable way forward to keep our children safe, because that's our number one goal. Keep them safe, keep them in school, minimize disruptions. And that's what we're trying to do. So.
No, I appreciate that very thorough answer of the reasoning behind the updated regulation. And I don't disagree with the continuing mandate and the eventual need for an end to it. My point was simply that during the midst of Omicron, when parents and educators are very concerned, it's challenging to think that we will be in a place soon, or perhaps even the school year, where those off ramps would allow to keep people safe, given that I would say even a couple months ago, people didn't see what was coming with Omicron. So I appreciate your answer. Thanks.
One thing I gotta add, just because is one, the state board and I have found a way to keep the mask requirement going pending your approval for the rest of this school year. That's one. And two, we know now Omicron's impact is less severe than Delta, but the best defense against it is being vaccinated. And so if vaccinations shoot up because of this regulations, then I'm gonna say we did a really good job in fighting Omicron too, because this would help do that. And so it's another incentive in there. So if anything, we put out an off-ramp that is gonna help fight Omicron too, because we know that those who get Omicron, if they're vaccinated, it's less severe on them. So that's the one piece I would add in that. So the timing may be in some kind of, I'm not going to say in a perfect way, but the timing may be right to incentivize people to get vaccinated if the thing that they're most annoyed by with is this face covering and they want to take it off. So yeah.
Thank you. Certainly, I'd love to see more counties have more and more people around Maryland get vaccinated. Thanks.
Delegate Sample Hughes.
Thank you, Mr. Chair, and thank you to all those attending today for this healthy discussion. And I do appreciate the research that has been done. I know it has been referenced that you've researched other states and found things that may be working and may not be working. And I guess for me, as a parent and as a Maryland legislator, I'm just constantly concerned and thinking about the timing of this, given the fact that our governor is ramping up, if you will, by having the National Guard on available to our counties to make sure, testing and vaccination and things of those nature are happening properly. But yet we're speaking and talking about off ramps when our governor is ramping up. So I find that quite concerning. The other thing that's very concerning to me, just in this past, in December alone, we've had about 400 Marylanders, perish as a result of this. And I just very, very much concerned. My questions to you at this time are, I know, Mr. Superintendent, you referenced that, superintendents can call you, they can do this, they can do that. What is your level of staffing support to monitor and help all these jurisdictions if it comes to pass with these various off-ramp options? And then the second piece is, has the health officers throughout the state been in communication with you, given the fact that their level of responsibility is constantly going up with the responsibilities they have with the nursing homes, the prisons in the counties, and things of that nature, while they still are probably going to need the guidance of the superintendents for each one of these jurisdictions? So I'm just very concerned about where we're going at this juncture when this issue, and this is life or death situation, is occurring here in the state of Maryland, to have this discussion today. If you can answer that, Mr. Superintendent, I would greatly appreciate it.
I think I have your questions, but so one, am I staffed? Yes, I can figure this out. Could I always use more staffing? Yes, but I'm not asking for staffing for this regulations. I will figure it out. And I have been very responsive. There's only 24. There aren't 1,100 districts like in Texas. So we can figure this out. On top of this, in terms of communications with our health officers, MDH and I have a biweekly call, Dr. Chan, who basically coordinates with the health officers. And in addition to that, Assistant Soup, where health education lives, has a biweekly call with all health coordinators who work at the district level, as well as the county level health staff. So we have multiple points where we're regularly communicating on this. And when I did come up with this off-ramp with the state board, they were brought along with it as well. At the end of the day, I would say Delegate Sample Hughes is one, extending the face covering requirement, which is a tool in our toolbox, and also incentivizing the right behaviors to fight the Omicron and deal and avoid more deaths and things like that. And so that's how this is designed, and doing it in a urgent manner through the emergency reg process. The only other manner would have been to come up with a permanent reg concept that would have been too slow and taken too long to be able to do this. So this allows this school year to, one, continue the face covering requirement to help slow the spread and keep people safe, and two, allow for the right set of behaviors to be able to fight the Omicron and the COVID variants that we're seeing. So those are the two things I would say.
Thank you.
Thank you, members. Seeing no other legislators who have questions they wish to ask, we'll now proceed to the witnesses. And staff, give you a second or so to do what you need to do. But the four witnesses who are opponents, and then there's a proponent, and then there's a second set of opponents. We're going to hear first from the opponents in this order: Katie Hammond, Benjamin Heiser, Jenna Butler, and Brian Thompson.
Mr. Chair, before we move to the
Certainly.
witnesses, I just want to
Oh.
make a comment. Just that, first of all, I'd like to thank the superintendent and the chair. They have been very patient throughout this process and very responsive to this committee and our staff. So I want to thank you for that. As we move on to witnesses, we understand there was a technical glitch on the website that might have prohibited some folks from submitting witness testimony or signing up to testify. We have accepted all written testimony since then. Anybody who's reached out to us who had a problem uploading their testimony, we've accepted that even after the deadline. And all members should have received not just the testimony for today in their emails last night, but also the emails that this committee received immediately after the state board made their vote. So you have two sets of witness testimony written for today, as well as the emails we received back in November. So I just want to refer members to their emails for the written testimony. Thank you, Mr. Chair.
And if I may, I would just like to second what you said about Chairman Crawford and Superintendent Chudhuri. We're legislative and executive branch all working on this together. So thank you. Ms. Heyman, are you there? If not, Mr. Heiser. Mr. Heiser, please proceed.
Good morning to esteemed members of this committee. I wanted to cite a couple things. Is that Superintendent cited a lot of states, but he did not cite Florida, which is having some excellent outcomes as far as not masking. And we keep revolving around this conversation about communities. But the Board of Ed has dealt with schools. Now, we haven't lost children in schools, all right? Now, if we're worried about the communities, that is a local public health decision. And as far as the communities surrounding, each school and things along those lines and vaccination rates, another thing that has not been cited is that some of the most heavily vaccinated counties that we have here in Maryland match my county here in Harford County as far as infection rates. So that off-ramp really isn't a very good metric. Also, when they came up with the off-ramps during that discussion, they couldn't even agree with the data that they were looking at, whether it was accurate or not. So that kind of really concerns me. And then we look at the CDC, where they went from quarantining from 14 to 10, now to 5 days. This seems to be quite arbitrary. The number just, it seems to be a convenient number for them. But if you look at their website about face coverings, they go through different types of face coverings, but they say the N95 mask should not be used except for medical personnel, not for children. not for anyone else, because they want to prioritize that for healthcare professionals. However, the CDC does not have one single US study about the face coverings of non-medical masks and their effectiveness. They can't cite one whatsoever. No one on this board can find one because they don't exist. I can scrape them up for you from Canada, UK, Finland, all over the place, but there's not one here in the United States. And that's very disheartening. Unfortunately, this panel has provided the Board of Ed an extra set of powers that they were not equipped to have. They're not MDs. This is a Board of Health issue and should be handled by the Board of Health on a very local level. I appreciate everyone's time, but if you're worried about the community, it should boil down to if that specific county has decided to mask every venue and masks do work, then that would slow things down. But if it's just the schools and nowhere else, well, then you're only masking a small portion. Thank you very much for your time.
Thank you. Mr. Thompson.
Hello, can you hear me?
Yes.
All right, thank you. All right, good morning. Hi, I'm Brian Thompson. I'm chair of the Concerned Parents of Carroll County. I have 4 children in the public school system. We're now going into year 3 of the pandemic, and yet here we are continuing to instill unnecessary fear into our children. Children, by and large, are not the ones dying from COVID. They are not the ones flooding our hospitals. They are not spreading it at the rate of adults. In fact, we know that they are the least vulnerable to this disease. The emergency regulation up for vote today was written during the early stages of Omicron and is now outdated. We now know that fabric masks are not effective in slowing the spread of Omicron. We also know that Omicron spreads much easier regardless of vaccination status and is less deadly, facts that the proposed off-ramps do not consider. And although the pandemic, we have seen evidence across the world that shows that the results of masking school communities is immaterial, including here in Maryland, where we have communities that are 80% vaccinated. But our state superintendent and our state board of education wants to ignore these facts and cite anecdotal evidence to support their failed policies. For political reasons, they can't afford to let communities in Maryland let their children return to normal because it would provide further evidence that our policies are ineffective. It is time to stop placing the burden of the pandemic on our children. It is time to stop masking our children to protect adults who are unwilling to protect themselves. Parents like me have been saying over and over that history will show that closing our schools, teaching our kids from a computer, masking our children will have devastating effects for years to come. And yet here we are, now we have history, and now we see the largest education gap our community has ever seen. But even worse, we're seeing an increase in suicides and overdoses in children and in young adults since the start of the pandemic, far exceeding COVID deaths. The silent pandemic is the real emergency, and not even a fabric mask mandate is going to make a difference. We need to stop punishing our younger generation and focus on protecting the most vulnerable, the elderly and the adults with the compromised immune systems. Kids are safe from COVID, but they're not safe from the politics of our superintendent and our state board of education. I have a son in the 1st grade who's afraid to enter public places without wearing a mask, even though he's completely safe. I have a daughter who has an individualized learning plan where visual cues and facial expressions are so important to her, but have been lacking under these policies. Masking our children doesn't make them brave. It doesn't make any of you brave because you don't have to suffer the consequences. And this isn't about masking as an example to teach them virtue or patriotism. It's none of that, but it is child abuse. And everyone in this community who votes for this emergency regulation is an accomplice to this abuse. You have a chance to make things right for our kids. Please do not pretend you have all the answers. Please don't try to control the spread of a virus that nobody in the world has been able to accomplish. Instead, focus on what the most vulnerable and let the communities take back control of their school systems so we can return to normal. Thank you.
Thank you, Mr. Thompson. Jenna Butler, please. You're muted, Ms. Butler.
I'm sorry, my internet just disconnected right when I.
You're fine now. You're fine. No problem.
Thank you so much. I had some more remarks prepared, but I did just want to really reiterate two really important points that I feel like are being a bit lost in this discussion and in this meeting particularly. Droplet transmission we've moved on from that. It's airborne transmission, and masks, particularly cloth masks, are not effective. The majority of our kids in schools are in cloth masks, and this policy is ineffective. The science has changed. We've moved on from that. I also wanted to really hit the point home about pinning our off ramps on the vaccines that don't work as they were promised to us. It just seems extremely unwise to center 2 of our 3 off ramps on the vaccines that come with ever-changing guidelines. The superintendent just said we could be changing it if we decide to include the booster. We could also be changing it as new groups are eligible. That could affect that 80%. So it just seems that the instability and how this the guidelines are changing around this, it does not seem like a good idea to center those 2 off ramps on these vaccines. People get them at different times, they wear off. There's just a lot of factors there that don't make sense to hinge this on that. As for the third off ramp, reaching low to moderate transmission, which is 0 to 50 cases per 100,000, which is extremely, extremely low. This virus is a respiratory virus. They're saying that it's airborne transmission, and it's now endemic. That seems virtually impossible. I also wanted to mention that I am very concerned, as a board member mentioned at the MSDE meeting, this could be seen as a backdoor vaccine mandate. And I feel like I've heard the superintendent sort of reemphasize that. He wants to, incentivize people doing the right thing. He wants to, if it does incentivize people, he'll think that's done a good job. I feel like that idea is extremely misguided at best and coercive at worst. The effect that that's going to have on true informed consent for our students and staff. Maryland is one of the top most vaccinated states, and we still don't have any counties that have reached 80% vaccinated rate. As the superintendent mentioned, the Howard and Montgomery are close, but that could change again if we decide to include the boosters, if another group of people opens up for eligibility. And I just personally would like to add that I am extremely fortunate that I was able to decide to homeschool my children, but I have talked to dozens of parents, and that's my circle. Thank you. Thank you for having me, and thank you for your time.
Thank you for your time, Ms. Butler. Is Ms. Hammond or Ms. Heyman here? If not, we'll proceed to the proponent and Senator Alfred.
Thank you, Mr. Chair. If staff could let the proponent as well as the last group of folks in, we will take a minute. Okay, with that said, Ms. Novak, if you would, can't see you. Ms. Wendy Novak. Okay. Ms. Novak, you are in the room, but we cannot hear or see you.
Oh, I was still connecting. I didn't realize you called me.
Okay. We are ready when you are.
Okay. My youngest is in middle school in Carroll County Public School. I'm speaking today in favor of keeping the mask mandate with the off-ramps. Masking in schools is better for the community. Studies have shown school districts without a universal masking policy in place were more likely to have COVID-19 outbreaks. Nationwide, counties without masking requirements saw the number of pediatric COVID-19 cases increase nearly twice as quickly. There is no data that supports children are suffering from masking. Children are suffering from COVID. We must do all we can to minimize COVID transmission in our community and protect our children. There have been 4 COVID-19 deaths in children ages 0 to 9 and 9 deaths in children aged 10 to 19 since the pandemic started. This is just in Maryland. Over the past month, COVID-19 cases in children 0 to 9 increased by 40, and cases in children 10 to 19 increased by 38%. As reported yesterday, there are 41 pediatric acute beds and 10 children in the ICU. A week ago, a 10-year-old in Maryland died of COVID. A teacher in Century High School died. Removal of a mask mandate without benchmarks will make schools unsafe for the teachers and staff. There are better paying jobs for teachers that are providing a safe place. There is a teacher shortage in our county. This will make it worse. We cannot have an entire industry that is essential to life in this county feel unsafe to go to work. There are consequences other than death. The children suffer when they lose loved ones to COVID. They suffer when they miss school due to illness or exposure. Students from families that have COVID or are exposed can miss up to a month of needed services and regress as they wait for COVID to work its way through the family. The children are suffering. Our Board of Ed does not work with our health department to create safe policies. The current COVID guidelines were not approved by our health department, who is working with the state health department and the CDC. The CDC quarantine policy requires masking on days 6 through 10 of exposure. That will not be happening as lunchtime and other times in schools. The November state BOE meeting is another example of the CCPS BOE not working with the health department. The Carroll health officer requested the mandate be linked to county transmission rates, and Ms. Herbert from the BOE asked for the removal of the mandate without off-ramps. Our cases have been increasing at a steep rate since Thanksgiving. Hospitalizations in children increased sharply too. This is especially problematic because our hospitals are full. I know this from personal experience. My father-in-law had to wait days to get the care he needed because the 3 closest hospitals were not able to take patients. He survived, but I worry it will shorten his life expectancy and will lower his quality of life to not have received the care he needed in a timely basis. Please vote to keep the mask mandate and the off-ramps. Thank you.
Thank you very much, Ms. Novak. We appreciate you sharing that with us. Staff has told us that while we have 4 others signed up, it appears that Ms. Montgomery is the only one that we have in the room. So Ms. Montgomery, when you're ready.
Thank you very much. Good morning, members of this committee. My name is Megan Montgomery. I am the mother of a minority student in a Title I school district, and I'm vehemently opposed to these mandates. These mandates have a desperate impact on socioeconomically challenged families, many of whom are also families of color. We are seeing in the state that parents who can opt out of the public school mandate situation for masks are doing so and leaving only the parents for whom public school is the only option. Cloth masks are an insult to intelligent people. Kids have been sick since school has started, and stopping droplet spreading does not prevent transmission. This policy simply does not work. I would like to note that in Texas and Tennessee, both the CDC and the New York Times report significantly lower rates of transmission than Maryland, despite our high vaccination rates. I'd also like to take a moment to thank and support Delegate McComas' comments. Finally, looking at our current hotspots map, the New York Times tool, which is excellent, we can clearly see that states that have the highest mask regulations also have the highest transmission rate. We must have off-ramps for our children that are not tied to vaccination policies, as mRNA vaccines are for personal protection only. They do not reduce transmission or contagion, and they wear off. Please think with a science-based approach to this policy. Thank you very much.
Thank you, Ms. Montgomery. We appreciate you participating today. And with that, we are through our witness list. We have on the agenda just taking a quick break. Mr. Chair, how long would you like to break for?
I think whatever, only the time that's needed for staff to prepare for the roll call.
Okay, let's take a few seconds then. And staff, please let us know when you're prepared for the roll call. And as we did in September, we welcome members to explain their vote in a reasonable time frame while they're voting. Okay, it appears that staff is ready now. So with that, I believe Georgianne, the chair, and I will vote at the very end.
Sure. Senator Augustine.
Yes.
Senator Carter, is not here. Senator Casserly, not here either. Senator Eckerd.
I'm voting no. And can I state my reasons?
Please.
As a health professional, I'm increasingly concerned that masks in one way are providing a false sense of security to many of our children because masks alone are not, I think, as effective as hand washing and proper hygiene and distancing. And I think many times what's happening, stuffy noses, runny noses, hand to face activity also contributes to the spread. I also am concerned about local control. Although I do appreciate the off ramps, I think that's very important, and that was a very good compromise. I'm still going to vote no on this one because of the reasons stated.
Senator Hayes, Senator Hershey.
Georgianne, he texted me that he had to leave for just a moment. He might be back towards the end.
Okay. Senator Smith. Senator Smith.
Can we chat? You are, thank you.
Georgianne, let's come back to Senator Smith. He might not be able to hear us.
Certainly. Senator Waldstreicher.
My vote is yes. I want to express my frustration, similar to what Delegate Learman provided about how this is presented to us. But at the end of the day, this is a question of whether we want to continue the mask mandate or not. I've got 3 children in our public schools, and my commitment to my constituents has always been that I'll fight for their families the same way I fight for my own. I've seen the mask mandate keep my own children safe in our public schools and know it will help keep other children of my constituents safe. And that's why I vote yes. Thank you.
Okay, I'll go back to Senator Smith. Okay. Senator Young.
I vote yes. I would actually like to see us go stronger, but I certainly support the mask mandate. I think while it's won't do as much as I'd like to see done, I think it's certainly better than not doing it. And so I'm therefore in support of it.
Senator Smith.
Yes. My apologies for the technical difficulties.
No problem. Delegate Buckle, it's not here. Delegate Sample Hughes.
I'm going to vote yes, only because this is a more of a guarantee that we will continue to have the mask mandate. I really am disheartened by the way that the state board has put us in the position of whether or not to support this proposal or have it expire. Given the fact that some of our superintendents have already expressed they don't have access to the third off-ramp information of transmission in their schools at a daily basis. So I hope that the board really takes into consideration the logistics and ensure that our superintendents are prepared and equipped with the proper tools. Thank you.
I apologize for going out of alphabetical order. My list isn't correct. Delegate Holmes.
I vote aye, and in explaining my vote, I'm a little disappointed with the off-ramp scenario. However, I do not want to throw the baby out with the bathwater. Therefore, Madam Chair and Mr. Chair, I vote aye.
Delegate Jacobs.
Vote no.
Delegate Learman.
I vote yes. I have concerns about the timing as I expressed before on some of the off ramps, but vote to continue the mask mandate. Yes.
Delegate McComas.
I vote no, and just a brief explanation. The fact that the General Assembly is going to be in for a regular session This is the current mandate is going to be over in February 23rd. Things can change within a week or two. I think that we're the backstop. And so I just don't think it's necessary to pass this. God knows what's going to happen in the next month or two. But the point is the General Assembly will be in and can fix whatever is a problem. Thank you. I vote no.
Delegate Resnick,
I vote yes.
Delegate Shoemaker,
I vote no, and just very briefly, just as I was in September, I'm concerned about the precedent this sets with regard to the issue of the usurpation of local control over decisions such as this. And while I'm happy that there are off-ramps in this regulation that's before us today, I'm very concerned about the 80% threshold. Most of our health officers, as I understand it, and in particular, our health officer in Carroll County have indicated that 70% is the magic number for attaining herd immunity. So I don't know where 80% comes from. I don't think that was explained particularly well, so I'm voting no.
I see Senator Hershey is here. So Senator Hershey,
I'm voting no. Thank you.
Senator Elfreth,
Thank you, Georgianne, and thank you to the committee. I'm voting yes, and in explaining my vote, I think we can all agree we're 22 months into this challenge, and it's presented nothing but a series of difficult decisions for all of us, and particularly for our school officials, for our health officials. I'm voting yes for a number of reasons. This is the safest way to keep kids safe and in person, which we all agree. The common ground here is that is the best environment for them. I'm voting yes because we have a current positivity rate at 27.44%, which is alarming for all of us, particularly with this newest variant. And I'm voting yes because in speaking with our healthcare professionals, particularly with the heads of our hospitals locally, we are in crisis mode, and it's incumbent on all of us as members of our community and members of the state to do all we can to slow the spread and ensure that we can get out of this crisis someday and hopefully soon. Thank you, Georgia.
Senator Hayes.
What's that? Yes.
And, Delegate, I'm sorry.
No, I was just saying, please record me.
Yep. And Delegate Rosenberg.
I believe Senator Hershey is back.
All right, we got him.
Oh, okay, thank you. Well, I want to thank all those involved, committee members, professional staff, our professional staff, Department of MSD staff, the public who took their time to testify. This is an extraordinary situation that we have faced for the last 2 years, continue to face. What's our primary concern is the health and well-being of all Marylanders, in this instance, our students and our teachers and other professionals in the building. We all believe there are flaws, or I think the vast majority of us, if not all of us, believe that there are flaws in this regulation, which we are voting on, but we cannot let things lapse without any further action being taken, because then we would have no safety regulation in place. So for those reasons, I vote aye.
My tally is 11-5 in favor.
That the motion, the emergency regulation is approved. There being, Madam Chair, do you wish to add anything?
I just want to make clear for the audience, I appreciate this is a complicated policy area. From my understanding, and Georgianne, please correct me if I'm wrong, by our vote today, the new emergency regulation immediately goes into effect.
Yeah, that's correct.
Okay, thank you. I just want to clarify that for the public. With that, Chair Rosenberg, I actually just want to thank our staff, thank the board, State Board of Ed, our superintendent, the chair, and the members here, and everybody who participated both in today and by sending in written testimony. We truly appreciate your participation.
And we are hereby adjourned.